Dr. Manjiri Somashekhar, lead pediatric surgeon at Aster Hospitals, Bangalore. 29th of December is observed as National Pediatric Surgery Day in our country. This year the theme is dealing with urinary tract complications or problems in children. So what does this include? This includes problems or swellings in the kidney, the urinary tract infections, external genital problems like abnormal shape, size, or any infections happening in them, undescended testes, swelling in the groin, testicular swelling, any emergency problems happening in urinary tract of the child. So these problems should be identified at correct time and addressed and taken help from a pediatric surgeon. One of the most important problems in children we face nowadays is the urinary tract infections. It is very common. One need to identify that the child has got into urinary tract infection. The symptoms are excessive crying while passing urine. There can be redness around the external genitalia. The child can come with very high fever, smelly urine. Sometimes you can find blood in the urine. So this needs to undergo urine routine microscopic test and a culture sensitivity test. Treatment needs to be very appropriately framed and the antibiotics have to be given to 10 to 14 days to get rid of the infection. Next question is, why does infection happen in small babies? In very young babies, those who are within the diapers, you need to take care of the diaper timing. Diapers need to be changed once in 2 hours. It shouldn't be very tight. The child should not be kept unattended if it has passed stools, because the stool remaining within the diaper the organisms can always migrate into the urinary tract, and that can be one of the causes of urinary tract infections. Next is, if your child is having urinary tract infections again and again, once it is treated, in few days it's coming again and again, then you need to look into the other problems, whether there is any phimosis, that is excessive skin of the penis, which is harboring the organisms and causing urinary tract infections, or it can be any kind of block within the urinary tract like posterurethral valves, or other common causes reflux. Reflux is one of the most dangerous causes of urinary infections, because the urine which is staying in the bladder for a longer time, it has all the potential to get infected, and the infected urine going up, reflexing up to the kidneys, is carrying its infection from bladder to the kidneys, which is very harmful for the growing kidneys. So it needs to be addressed in an appropriate manner. All the refluxes need not undergo surgery, but they need to be monitored and certain medications need to be given. If you observe any of the symptoms in your child, please do contact the nearest pediatric surgeon in your vicinity for further management. Pediatric Surgery Day is observed once in a year on a particular day, that is 29th of December, by the Indian Association of Pediatric Surgeons, to spread a word and awareness about availability and treatability of certain problems in the children by a pediatric surgery community. Thank you.